on YouTube, and because I put the content up that I put up, it feeds me that algorithm. And so this one came up today: 7 common pregnancy mistakes that increase risk of postnatal complications. So in my head, like, I'm thinking like birth, like what is this? So I click on it, and it's from a occupational pediatric therapist. I think she's from overseas because she speaks with an accent, British accent, something along those lines. And she's got 785,000 subscribers and 1.9 million views on this post. And I couldn't get through the first 7 seconds of it before I was literally throwing F-bombs at the screen, and I had to pause it and like, okay, fine, just a little bit more. Where is she going with this? And basically she's like, how you get out of bed, how you pick up things off the floor, how you pick up your toddler puts you at risk of diastasis and prolapse and and all this stuff. I'm like, what? No, like, what year is it? Like 2000? Like, we're not doing this anymore. And this video was posted a year ago. And then she goes on to say, well, this is not my area of expertise. I'm like, cool, way to bury the lead. But then she invites in a physio to demonstrate rolling to the side and getting up out of bed, and like all these, again, really basic things that I would use with somebody who might be symptomatic. But for somebody that's not having any symptoms, like back pain or things like that, I want moms using their abs. I want you to get out of bed. I want you to pick up your toddler. I want you to do all of those things so that we don't decondition you. And that brings about a really huge point. Christina Private's been talking about that this year too. Like, if we look back on a lot of, like, this is exactly how we were taught as physios to work with clients 15, 20 years ago. There's even some classes now that are like, yes, this is what all pregnant women should do. And the tide is turning such that we're like, actually, no, instead of saying, don't do this, don't do this, don't do that, like, gatekeeping with absolutely no reason other than we don't know, we don't want to screw it up. And the other one that kills me a little bit is, just because you can doesn't mean you should. I'm like, how about we say, let's keep moving as long as you possibly can, as long as you're having as minimal symptoms as possible. So if you can want to get straight up and get out of bed, freaking do it, because you need those abs, and you're going to need them when you have a crying baby at 2 a.m. that really could give two shits about how you get out of bed to go feed them when they're a newborn. Picking up your toddler, like, guess what? Toddlers don't care either. So again, like, keep lifting. Again, we just had the 2025 Canadian postpartum exercise guidelines come out, and Margie Davenport was just on the podcast talking about this. Like, again, exercise, individual approach. Yes, if you're having issues, we need to address it, but like, putting out a video globally saying these are the mistakes, and again, it's hitting those vulnerabilities because we don't want to screw up as pregnant moms. These common mistakes that increase the risk of postnatal complications. Like, that sounds freaking serious. Like, I'm thinking, what is she talking about? Like stillborn? Like, what is she talking about? And that's, again, remember, this is also marketing. They're trying to hit, SEO keywords to scare the crap out of you. And inevitably in here somewhere, there's going to be something that she's selling. But like, it's just infuriating that 1.9 million views of pregnant moms are watching this video saying, if I make these mistakes, I am going to have diastasis and prolapse and all these things that I'm terrified of. When in actuality, we have evidence that speaks to the more active you can be, the more you can, strength train and be functional and lift up your kid. And let's not worry about our abs anymore, because we have data that says we can do these things now. So it's infuriating to me that, 26 years into this, we still have people, because they're using social media, because they're getting that reach. And again, things live on YouTube forever, but this is only a year old, scaring the crap out of women and pregnant women who are just trying to do the right thing. And they're new to this. They're like, oh my God, I don't want X, Y, and Z, thinking that you're going to get pelvic organ prolapse because you just sat up straight and got out of bed. Like, we're not that delicate. So can't hold it in sometimes, but it just drives me nuts that this is still going on. And I ask myself all the time, like, how is this continuing to be perpetuated? Because we still have a lot of variation in practice patterns across the world. And because of social media, because of YouTube, things like that, if you have slick marketing and you have scary ass terms that are in your title that maximize for SEO and keywords and all that kind of stuff, you're going to get that reach. You're going to get people to click on it. You're going to spread that misinformation. So I'm curious, because I can't be the only one that keeps getting hit up with this kind of stuff. What kind of stuff that you're seeing that's scaring the crap out of either you or your patients. And just, we don't need to link to it. We don't need to feed the algorithm beast, but just give a quick description of like, hey, it was this and this was unreal. And, but then also I want you to click some good information. That you can send the link to. We can feed the algorithm with the good information, but man, like, drives me bananas. Let me know.